Daddy.
Yes, ma'am.
A big girl up there.
What's up there? The big camera?
Yeah.
I see
It's a
it.
big camera.
Yeah. You hello, this. Right, Daddy?
Yes, ma'am.
What toys did you bring, Muriel? Did you bring some toys too?
Yeah.
Did you today?
Yeah.
You don't want me. Why don't I
see
run
this
across
with
the
you.
street and
Here's
see
one.
if I
Why don't you
can
get it
find
going?
the other
Oh,
And then,
Let me
Vim
see
pack.
something here for you.
yeah.
Let me see this sound right here.
Yeah, Ida and I were frantically.
Yeah, okay. Just let's try it
Vim
really.
packs in the formal.
That's it. Little tiny bits. Good girl. Excellent. She's still, using broader production there. That's what I was looking at. She's blading still.
yes. Yeah.
Instead of releasing it quite. But she can get to that, I'm sure. It's one of the things I was seeing on the tape. Are you ready?
Yeah.
Okay, well, let's take these out. Take them all out, and you can put them in,
Okay, guys.
Yeah,
Do you want me to
in-
go across and see if I can get the Vim pack?
if you want.
I think I know.
I will pretty much know, I put the test together,
Hi,
so
Daddy.
we can kind of get it.
Okay.
But what you might want to
Hi,
do is give
Daddy.
it to her at another time, the whole thing.
Okay. So.
Anyway,
Okay.
you know?
So go look for it or not look for it.
I-
then,
I don't-
since you have
I
it in
don't
your
think
memory.
it's gonna,
I
it's,
think
Okay.
we don't really need it. then.
no, we
Okay.
don't. We're gonna put them,
Okay.
Mary, we're gonna put them in. Good, and I want to keep this job. In. Excellent. Okay, stick them up. What color do you want to put in first, Muriel? You want to show me? I want to just check something. What color is that?
Big.
Okay. Yellow.
Now.
That's right. Oh,
Oh.
that's right. Yell.
No.
Oh,
Oh.
good. You know what? What's this one?
Oh.
Purple.
Purple.
Yes, good girl. Let me help you. Come here. Purple.
Purple.
Pull.
Purple.
That's it. Purple.
Purple.
Good. These are a little above her, but that's what I'm just mapping, basically. Orange.
Ants.
Good girl. Turn around to me, Muriel, a second. Orange.
Ants.
Here. Ch. That's it. Ch. Uh-huh. Ch. That's it. Ch. Yes, right here. Ch. Let go. Let me do it. Let Debbie do it for you. Let me do it. Ch. Mm-hmm. I want to look. That's my phone. Ch. Good. Let me turn that off. I didn't know I had left it on. Somebody's calling me. Lovely, huh? Too bad. You're gone. Okay.
Who's that, Daddy?
That was my friend. Somebody was calling. Okay, let's just try this. We're going to do some of these that are easy for you. This is going to be easy. Let's just do ah.
Ah.
Good girl. A little more. Ah.
Ah.
Good. A little bit more. Ah.
Ah.
Okay, let me help. Let me help. Gentle, no small. Ah.
Ah.
Beautiful. Put it in. Good. Let's do this one. Let's just do ah.
Ah.
Good. Okay, hang on. Let me help. Ah.
Ah.
Let Debbie do it for you. Let me do it for you. Ah.
Ah.
Good girl. Ah.
Ah.
Okay. A little too big. I should be writing probably some stuff down, you know that? Oh, I forgot to do that. Let's just try this one, Muriel, for me. Let's just try O.
Oh.
Okay. Here. O.
Oh.
That was beautiful. O.
Oh.
Very nice. That was so nice. First she was sliding and moving. So try that on your own first. Let's just O.
Oh.
Okay, let me help you. Just from here. O.
Oh.
Good girl. Come here. O.
Oh.
Yeah, nice getting that lip in there. O.
Oh.
Uh-huh. Good. Okay. You can also stack them up.
Ah.
Up.
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 Okay, good. Let me help here. Up.
Up.
Nice.
Nice work, Mary.
Yeah, bring this lip in right here. Up.
Up.
Good girl. See this retraction here, Jeff?
Yes.
Sometimes?
Yeah.
Okay. Up.
Up.
Nice. Beautiful getting those lips together. That was really good. Okay, let's try this sound. You do it all by yourself. E.
E.
Good. This front vowel. E.
E.
Okay, let me help you with this. Just stay right there. Stay right there. You're beautiful. You're so good. E.
E.
Good girl. Let me help more. Let me do this for you. Let me do this. Let Debbie do it. E.
E.
Good. Come here. I want to see this. What's happening here?
E.
Close up, Muriel.
E.
Okay. Open again. Open. Okay, gentle. Small. Small. Close. Close. That's a girl. I don't think that's a normal. Is this what's going on now?
Uh-huh.
E.
E.
Because that jaw's, her lower jaw's in front of her. She's got like a class 3, but I don't think. So that is what's happening. Okay.
She got a class 3 in eloquence.
Okay. E.
E.
Okay, because this front of the tongue. Let's see if we can get this T.
T.
Good girl. T.
T.
Okay, without all this. Without that. Use your tongue. T.
T.
Good.
Nice work.
Good girl.
Open.
Let's look at this one all by yourself. 2.
2.
Those are nicer. Let go right here. Right in here. 2.
2.
Nice. Right here. Let go. 2.
2.
Beautiful. I loved it. I loved it. Okay. Let's try this one for me. Let's try toot. Yeah. 2.
2.
Good. She's still using these muscles to do it.
2.
Now let me help. You ready?
Uh-huh.
Okay, let go. Let go. Let go. Let go right here. You watching in the glass? Are you watching?
2.
Right here. Let's do ooh. Just here, Muriel. Let's just do this one all by itself first. Let go in here. Ooh.
Ooh.
Good girl. Right in here. Ooh.
Ooh.
Good. Let's try this one. Shoo.
Zoo.
Yeah, it's going to be hard, huh? Shh. Keep that in. Just not feel. Shh. Not like that. Shh. Okay, it's still too hard for you. Uh-huh. I want that to stay in there. Let's try this. Ch. She really wants to bring it forward. Okay. T. D.
T.
Mm.
Mm.
Okay, good girl. 2 of them. Yes, that was good. Here you go. We're going to play some games in 2 minutes.
Complex prompt. What you just did.
I don't know what I just did. No, for the no, that's still called surface. It's a single finger, but I'm just giving her the nasal.
Because I thought you were doing this.
I actually used 2 fingers here because she wasn't getting that whole tongue up.
Okay.
She wants to bring this tip. That's okay, you can leave it on. The tip down. She's got the tip pretty much fixed down. Remember what I was saying about the bunched? It's kind of, she's using this and this part of her tongue. So to get into the shh, you need mid-back.
Okay.
And what's happening is she doesn't know how to use that mid-back area, so she's kind of using the tongue like this in that jaw. Okay, so it hasn't really got independent movement yet, front to back. So that what she's trying to do with that, which you can see, is just give me, because the mid part here, leave that in there. I don't want that to happen. I don't like that pattern. Just feel it. Let's try this. There it is. You got it. You got it. Right in here. You ready? then we're getting too much tightness up in here. So there's a couple things going on. One is I would like to see better rounding and retraction with more ease, because it gets either tight in here, so a lot of times she gets more fixed up in the
I think
upper
a lot
lip.
of that is biologically oriented in that she had such a difficult time managing fluids when she was young, that she really worked.
Well, I think it's to keep the jaw up too, because what happens here is there's still some jaw sliding that's going on. So what happens is when you have an upper lip that is retracted, it stabilizes that lower jaw. So in some postures with some words, like say the word pie,
Pie.
you see there's a lot of the stability is happening through this upper lip
Okay.
fixing. So it ends up like this. Pie. She's doing most of the movement here. Instead of being able to release this, pie. So if we tried it this way, Muriel, let's just try it this way for me. I'm just going to help you with your jaw. Let go. Let go. Yeah, I know. I'm going to wait for you
Okay.
to let go in here. Let go in here. Let go. No, let go.
Okay.
Okay. Do ooh for me. Ooh.
Oh.
Okay. Right in here too. Okay. We've had it before, so I know we can get it. It's just, I've got to bring it from here.
Okay.
You're too cute.
Oh.
You are too cute. You're too cute, you know. You really are.
Oh.
Right in here. Let go. There you go. Right there. Perfect. Pie.
Phonetic.
Hard, isn't it? Yes. Because we want to get this release so that she can get into something like... Yes. Do it again. Let go. Let go. No. Let go. Let go. Let go. Let go. Let go. Let go. That's it. No, let go. Don't smile. No smiling. You cannot smile. Here we go. Yes. Yes. Beautiful. Then she can release these and start to get that nice, because what happens is they get, so everything then has to be driven from the jaw, and when that happens, then you can't release the tongue. So there's these relationships that happen between things. Okay, shall we make them go up?
Uh-huh.
Build them up?
Uh-huh.
Okay, let's try this. Up.
Up.
Nice. Again, up.
Up.
Yes, I love to see this. I love that. Up.
Up.
Beautiful. Not too big. So nice. But getting this in here released a little would be good. So put it up. Okay, Debbie's turn. I'm going to put the orange one up.
Up.
Yeah.
Up.
Yes. You're going to put the orange one, where are you going to put it?
Up.
Good. I'm going to put the orange one. This isn't orange. Is this orange or red?
Red.
It is. It's red. I'm going to put it up. Let's see. Here's a purple.
Purple.
And I'm going to put it up.
Up.
Beautiful. Put it up. And I have another purple.
Purple.
Not so much jaw. Let me stabilize you. Purple.
Purple.
Beautiful. Purple one.
Well,
So we want to also normalize movements within normal range. That's the other objective here, instead of using too much. So when you use too much action, then you can't get the little muscles involved. They just get overridden all the time. You know which this one is?
uh-huh.
This is green.
Green.
Let me see if we can do this sound here. Because I heard you say something like k, 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 k. You know where I heard you say it? You said it caterpillar.
Caterpillar.
Yes. Cat-ta. Cat-ta.
Caterpillar.
Pill. Yeah. You want to try that whole thing? It's an awful big word. It's a big word, isn't it? How about the word big?
Big.
Good. Big.
Big.
Beautiful. And that's that nail. I can do it. No, it's not you. I mean, it's, forget it now. She seems okay, but I can tell that she feels it. Big.
Big.
Okay, keep that small. Let's make this small. Big.
Big.
Yes. G.
Da.
No, let's let this go. G.
Ga.
Good girl. I just want to see what we can do. Normally I wouldn't be back here, but we're just going to try. Go.
Gun.
We're going to let go of here. Go.
Go.
Yes. Good. Let go. Go.
Go.
Yes. Very nice. That was very good. You're getting that. Where are you going to put it, Muriel? It's not Muriel, it's
Marielle.
Mariel. Mariel, here's that green.
Game.
Look. It's back in here. This is going to be way above. This is above her, but I wanted to see what we can do here. Grr.
Go.
That's it. It's back in here. Green. Good girl. Grr.
Go.
Een.
Game.
Here, let's break it up. Let's just do the grr. Grr.
Go.
E.
E.
N.
N.
Mm-hmm. N.
N.
So we were
Nice.
talking about yesterday with
Here you go.
maintaining the duration of the nasal.
Because she does not. She has a hard time getting the tongue in the position without moving the jaw around, so that's why the stability is also important, but then maintaining the timing is also important. Okay, let's do 2 more.
2.
Here, let me help you with this. I'm going to just do it for you. Let Debbie do it. 2
2.
more.
More.
Okay, good. Let's try it again. I'm going to keep you rounded. 2
2.
more.
More.
Beautiful. Nice. Keep the rounding all together. I'm going to try that again. Let's do 1.
More.
Okay, Muriel, look at Deb. 1.
More.
Mm.
N.
Okay. 1.
One.
Yeah. I just need to get your body. I need to get your body to help you here. Good. 1. 1. 1. 1. More.
More.
Okay, let's hear this. Let's do this. More. Oh, you felt that, didn't you? Let me show you something. I want you to feel this. You feel my muscle get all tight.
More.
That's it. Yeah, it's right there. Yes. Very good. Very good. Okay, shall we play something else?
Yeah.
Okay, let's try. Yes.
Yes.
Good girl. I will say that in. Yes.
Yes.
Okay. I want to try something, Muriel. Here.
Okay.
Right here. Just stay right there. No. It has to stay inside. Let me do it. No, it has to stay in. Has to stay inside. Oh, no, it has to stay in. Do t, 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 t. That's it. T. No, it has to stay in. We got to get that top there. T. Good. T. It's just like that. It's the same place. T. Okay, to work on to get that, because she's getting that pattern in and it's going to be difficult to get rid of it. So it needs to be done now, because what's going to happen is that's just going to become a real pattern. The S.
Daddy.
You want to get up for 1 minute and go give Daddy a hug? I
Yeah.
bet you'd like to do that, wouldn't you?
Yeah, are you having fun?
What's wrong, Daddy?
Well, she's going to get it.
I'm going to get another toy. Would you like to pick? You can make, you can pick. Okay, let's have you pick. I'm going to get into some double and syllable words. So let's see if maybe she wants to do this. Give her a choice. Marielle, you can choose. We can make some faces, or we can do fish.
Fish.
That's a good choice anyway. Fish, fish. Just keep this. Fish. It's this tongue that's gonna drive me crazy. Shh. Let's get this piece. Stay in there. Shh. No, it's gotta stay in. Let the air come. Just give me the rounding. It just wants to pop out, doesn't it? Just does. I know. I see that. Okay. What are we gonna do first?
Fish.
Yes. What do we have to do with the box?
Box.
Box.
Yeah.
Box.
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 Just stay right there. Box. Box. That's it. And we have to what? We have to.
How do you get the toys out, Marielle?
We have to take it out.
Out.
And we have to do what? We have to open.
Open.
Yes, that was beautiful. Okay, open. See? It's stuck.
Yeah. Tuck.
Stuck. Now, that's interesting. Try that again for me, Muriel. Stuck.
Tuck.
You see what happens? You see the difference? You see why?
Because it wasn't.
Because of the ka.
The co-articulation.
And that's what I mean by the word specific, what I was saying to you before. So, depending on the word context, she goes for the shape, the major shape. And if it's pulled to the back, you'll see more retraction and you'll see better. It's not excellent, but it's much better. It's toward the target. It's toward the final target.
So
Okay.
the word therapy targets then would start with those kinds
Yeah, you could start with context that you wanted to get them in better because it's more facilitating for her for sure, which is not that, I mean, I wouldn't say that's radically different. Well, it might be radically different in the sense that you were looking at the motor movements you can do to achieve or to get to those targets. But what I'm saying is she uses the most expedient subsystem to get to those targets, but it's still gross. They're still not independent movements necessarily. So instead, she's got too much jaw, okay, coming down there, but she's got that whole tongue can move to the back more. So she keeps the tongue down in the front, so it's like this, duck, instead of in something like, what were we doing a second ago with the S? I was just doing it by itself, actually. I was just doing it. So if we did sun, I think that it's still going to pull it down, but it's going to look different and stuck. So let's play around with that a little bit and investigate.
C with, I mean,
See, it's going to come forward. I can just tell you already.
yeah.
See, it's going to come out front.
Help
Yeah.
you?
Yeah.
Why don't you ask Miss Debbie?
Duck. Hear me.
Oh, right. I'm going to help
Help
me.
me.
Beautiful. That was nice. Okay, so there, my goal is, it's almost like I wish I could do a voice override in every thing so that you would know what I'm doing. But there, it's to get better, to get her jaw stable, to get better range, and to get more independent lip use, and help me. So it's not help my. Okay, so I mean the goals in prompt, I'm not going to say they shift. We want to get better range, we want to get better rounding and retraction, and we want to get better anterior tongue movement. That would be my first goal. Then I'd probably be, once she got that tuh in a better position, I knew she had it more finely controlled, then I would probably start working to her mid-back, because she'd have much more control, and we'd probably get better sibilance out of that too. Right now, even the tuh is, And I know you're aware that she is aware, and I am aware of that. So I think it's okay. I think she's okay with this. All right. You know what we don't have? We do not have any red. There's no red.
No.
No red. Should we find all the red ones and take them out?
Out.
Okay, so too much range, not enough rounding, and not enough anterior tongue. And this here, I'm going to get her to let go of this. Can you let go of this a little bit? Mirror it for me. Out.
Out.
Okay. Let's keep it a little close. Out.
Out.
Yes! And did you hear the better teeth? Okay. So let's find the red ones and take them out.
Out.
Keep it closed. Right here. No. Let me help you with the jaw. Out.
Out.
Yes. Let's take them out. Is that a red one?
Yeah.
Take it. No, close up. Close. Out.
Out.
Beautiful. Let's see if we can find... Oh! We got to take it.
Out.
No. Small. Big. Out.
Out.
Yes. Let's see if we can find any more red ones. Yeah, we're going to take it.
Out.
Yes. We have to take it.
Out.
Keep this closed. No. Out.
Out.
Yes. Good girl. The other thing is, what you see us do more in prompt than you probably see in most other treatments is we'll say no. Not, oh, good job, try it again, but no. Because then you can go in and change, what you want to change
Daddy.
with help.
Yes, ma'am.
You going?
No, ma'am. I'm going to stay here and watch you play.
Yeah.
Stan. So would you like the yellow boat?
Yeah.
So we're going to put all of the yellow ones in the yellow boat.
Yeah.
And we're going to put all the green ones
Yeah.
in the green boat.
Yeah.
Okay? So what should go in this boat? Marielle, should I put the green one? Where should it go?
Right here.
You're right. And it's going to go right
Right
here.
here.
That's it. Try this again. This is a tough one, I know. But let's use it. Let go here. Let
Okay.
go. Because I want the tightness, but right
Right
here.
here.
Good girl. Here.
Here.
Good. Let's get into here. That's a lot. I know. It's okay. It's okay. Beautiful. Very nice. Okay. What about the blue ones? Where do they go? Do they go right
Right
here?
here.
Okay. Put it in right. Put it right in there. And sometimes, I'm just going to tell you too, like from the production right here, there's a lot of things going on, so for me, I cannot control every aspect, you know. So normally in a session, you would want to start out with whatever motor actions to productions you were going to work on, so you would do a warm-up probably. With someone like her, it would be easy to do, because she's fine with that. So that they get a sense of what that sound is, what you're wanting from them in that sound, how much range you want. So you don't do every sound, but I mean you would do the ones you're going to probably work in and the lexicon you're going to work on. Give them some practice with that. Then you get a chance to generalize it throughout your activities. So I wouldn't choose every word that we're just playing with right now. I certainly will not choose in therapy to be. But I also, if they were situational and if they came up, I might prompt them, but not necessarily expect her to do them. Okay? So that's another way of putting that feedback into the system, but not necessarily. It's a step or two above where the child might be. So you're giving them a chance to feel it and incorporate it, but it's not something it's necessary for them to do.
That's what we're talking about now. That's what-
Now, you can also, like I said, use mapping for a concept. So if we wanted to, what are we going to, let's say we put this here. Where is it? Do you know where that is? Muriel?
Yeah.
Do you know where that is?
Yeah.
It's under.
Under.
Under the boat. Now, I didn't ask her for that protection. I mean, I didn't expect, if she could have said it or not said it. So with certain kinds of concepts or relationships or things, you can also just go ahead and prompt the whole word and explore the concept without having to worry about so much. Your focus is much more than on the conceptual understanding and mapping it in for them. In other words, you're giving them the motor to the verbal to the concept. You're just trying to put it all together for them as much as possible, so that then when they recognize it, they also start to have a motor map of it. Because sometimes kids know what, they kind of have an idea of what they want to say, but they don't know how to produce it. They can't get those elements together, they don't know where to start. Okay? So we could put this, in,
And
very nicely done, in, that's it, in, let go here, I just want you to let go, in, or we could put it under,
under.
put it under, you do it, Miriam, put it under. How does it go under? That's in, can you put it under?
Under.
That's right, we could put it under. Could we put it on top?
Up top.
On top.
Top.
Good, put it on top. Can you put it on top? Put it on top. So we could
With
actually
children
start.
like Miriam, this is such a nice way to work the conceptual because it gives a motor
Component to it.
So
Now,
that it's not simply a abstract conception that she's trying to learn, but she's also learning
Right.
the motor pattern to it. I was talking about this in the aphasia class.
This is good with adult aphasics
Very
too.
good, or with TBI, because you have incorporated the physicalization.
Now, normally with some, we might do things where we would actually go under the table. I mean, she's a step above that, but we could also do that as part of it too. Often I will do pictures. We'll do Polaroid pictures of me under the table, them under the table, and then we'll match
my wife
them.
does for
Then
the
we'll
words.
match them, and we'll do stuff like that. But then you can also give them, like I said, the motor speech map on top of it. So they can bring it, they can pull it forward when they need to. Because getting that underlying concept is fine, but a lot of times it doesn't map onto the speech system for them. Okay, all right, are you ready? Boy, I'm taking all this time and you're being so good. You're being so nice. Thank you. Okay, whose turn? My turn or your turn? Whose turn is it going to be? Debbie or Mariel's?
Devin.
Debbie.
Debbie.
Beautiful. Okay, Debbie's turn. Let's see. I'm going to pick this one.
Yeah.
I have blue.
Blue.
Right here. Blue. Blue.
Blue.
We want to get this up. It's okay, Muriel.
Okay.
Debbie's going to do it for you. Blue.
Blue.
Let's try this. I'm going to put the L and the U together.
Okay.
We're going to let go. No smiling, remember. No smiling. Blue.
Blue.
Okay. Hard one. Put it in. Put it in the boat. Where does it go?
Here.
Yes, right. Here.
Here.
Muriel's turn. You take one and you do it.
My turn.
Your turn. You can say, you know what you can say? You can say, my.
Turn.
Let's try my. My
My
turn.
turn.
Good, my turn. Beautiful. Turn it over. Let's see what you get. You want help?
Yeah.
Is it hard to turn over?
Yeah.
I think so. Can I show you a trick?
Yeah.
Look what you can do. You can take it and you can pull it right here. And now you can turn it over. No, look what color it is.
It's pink.
It's right. You are right. It is green.
Green.
Here. Green.
Green.
Good. Put it in the boat. Here. That's it. Keep it in your hand. We're going to do it together. We want to put this part in. There you go. Good. Whose turn?
Me.
Okay. You want your turn again? Okay. My
My
turn.
turn.
Beautiful. Turn it over. Show it. Do it like I showed you. Move it down. Turn it over. You got it. Let's see if you can put it in the boat.
Boat.
Let's try that. In
In
the.
boat.
Let's try the
The
boat.
boat.
Whole thing. In
In
the
the
boat.
boat.
There you go, in the boat. So within a session, you should be in phrases, even with somebody who's at a single word, because now you can help take them there. So we would also, one of the other things we would do as part of a session is we would start to, with that lexicon, build some stock carrier phrases that would be used with almost everything. So in the boat. Yeah, can you do that? Oh! It's my turn.
My turn.
Very nice. And I have yellow.
Now
And I'm going to put it in
in
the.
boat.
Let's do the
The
boat.
boat.
Whole thing. In
In
the
the
boat.
boat.
Beautiful. In the boat.
Look at this.
You like my sweater?
Look at this.
Who's... What are you looking at? Show me.
There.
What?
Oh no.
Oh no. What are you looking at?
And look at that.
Look at that. Are we looking at the tree?
Yeah.
The tree is moving?
Yeah.
I know, it's pretty,
Yeah.
isn't it? It's very pretty.
Yeah.
And she loves touch. She's holding my hand, she's next to me. And what you find even with some of the autistic kids, which is very interesting, is what I find interesting with some of the older guys is pretty soon they're leaning on you. You know, they're just their bodies on you. It's so funny. Just this, you know, it's an interesting situation. I mean, it's just for stability, support, trust, whatever it is. It's a comfort. There's some comfort in there.
Hi,
Mm.
Daddy.
Big girl.
You are doing so good. Yes, you are. Okay, let's do two more. Your turn.
My turn.
Part.
Are you doing why
Why I'm doing this? Because what I'm doing for the TH is you want to work in a little small triangle here to stabilize that jaw. Remember?
yeah,
This.
you're kinda going
Well, I'm
like
doing
you're
this for the
doing
the,
Okay.
the,
And this.
the,
Okay.
the. So you want this movement very small, though. You just want a tiny opening. So she was doing that nicely, actually, weren't you? The.
The.
Very nice. And that tongue isn't coming out of the mouth, which is not what we want. We don't want it to. So it's a very tiny movement that you want to give her. But it's nice to put it in there if you can, because you're also teaching them the syntactic form. So you want to really get that in there if you can. And that's a nice way to do it. Okay. Whose turn? Debbie?
Debbie.
Okay. Let's just do this. Debbie.
Debbie.
That just stabilizes that so much for her. Debbie's turn. Okay. Oh, I got yellow. Let me try this. Yellow.
No.
Oh.
Oh.
Good. Yellow.
No.
Let's try it again. Yeah.
Lar.
No. Stay small. You were right. Yell.
No.
Oh.
Oh.
Yes, yellow. And I'm going to put it in
In
the
the
boat.
boat.
Beautiful. In the boat.
Nice job, Marielle.
Yes.
Yeah.
Yeah. Let's try this phrase too for you. I
I
want
want
it.
it.
Good. So, Which one do you
How
want?
did you know that was
That one.
a perfect phrase? It kept everything
Together.
How did you know?
Because that's what that phrase is, especially with the it. I'm just holding her very tightly, so she's having to independently use that tongue without
Daddy.
overusing the jaw, because normally she'd do I want it. So by the whole bite block situation, what you're doing, but your bite blocks still restrict everything. So this gives you that same kind of trade-off. When you put a bite block in, it changes the dynamic relationships of the articulators. That's essentially what it does. Okay,
Plus, that was all anterior.
I want it.
too.
I want.
Let's try this. Let's go. I,
I
and I'm just going to stabilize her here, so I think I'm going to just try this. I want.
want.
Okay, we need to get this. Want it.
It.
Very nice. You got it. You got it. You're going to put it in.
And
Let's try that phrase too for you. Let's let go here because these would be good ones for her. Put
put
it
it.
in.
Boat.
No, not boat. Not boat. We're just going to say put
Put
it
it
in.
in.
You see what's happening here? So that's why I'm trying to keep her rounded. Just one more time, Muriel. Muriel, put
Put
it
it
in.
in.
Good girl. Put it in. Put it in the boat.
Boat.
Yeah. Eventually, we could do put it in the boat, or put it in the box, or put it in or put it in the. So, I mean, you could start using put it in as one of your carrier phrases, and then you would only be changing that last piece.
She still had some kind of over range of motion with that phrase where she didn't with I wanted. Would you go back to maybe I wanted and to give her that feeling of the reduced range of motion and then go? I'm just wondering if you would-
No, it depends. It depends. The it is going to reduce it to a very narrow range, and it reduces it more to what we would say a horizontal production. Want, by its very nature, is vertical. Want, because of the low vowel. So, yes, yes and no.
That was just a prompt technique. I was wondering if you would.
one of the things you would look at for her, for example, is I would like to get her more into horizontal productions and anterior, rounded anterior horizontal productions like boot, things like that. So she's got, because shoe is difficult for her, rounding is difficult for her. So anything that has the O in it, the oo in it, would be really good for her right now. Just as a bias position, just to show her a different way of doing things. And also it's going to reduce her range, bring her forward, and bring her anterior, so she'll get better tongue control in the anterior position. So, but put really would be another one that would be good for her. Let's try this really one time. Let's just try this. And I'm just going to stabilize her here so she can stay in this nice position because she's perfect. Put it in. Yes. Very nice. Very nice. Put it in. That's it. In. Keep it going, Mia. In. See how this feels this? That's it. That's it. That's a girl. Okay. So last one. Last one. Is that yellow?
Yellow.
Yellow. That's right. Yellow. Good girl. Yellow. Yellow. Put it in.
Boat.
Okay, you want to do the whole thing, so let's do that. Put it in boat.
Boat.
Beautiful. There you go. Put it in the boat.
Boat.
Yep. Go girl. Go Go, go, go. You have... Are you all done?
Yeah.
Are you all done?
Yeah.
Ah, we have too many yellow. We have too many. Too many. Too many. Look. No spot.
All done.
All done. That's it. All done.
Done.
Tell me all done.
All done.
Very good. All done.
All done.
That's it. All.
All.
Let's keep that. All.
All.
Not so big, little. All
All
done.
done.
What's happening? There it is.
Done.
All done.
All done.
Yes. All done. Shall we take them out?
Yeah.
Yeah. You're getting an idea, though.
Very
Okay.
good.
Yeah. And we need to talk more. I think probably from where you're sitting, it would be more interesting to talk. Oh, well, you're welcome. You're welcome. To talk more. What happens is the system starts to refine. So first of all, we want to get that range down and get that jaw stable. And the jaw is not stable sometimes because she moves the tongue through the jaw as well. So she's
Right.
moving the tongue.
Using the jaw to manipulate
The
the
tongue.
tongue because of the size of the tongue.
Well, her tongue is, it's not so much size as it is tone in the tongue. As that tongue becomes more flexible and usable, it won't look like this so much.
But she's also moving her tongue the way she is because there was a time.
Put the puzzle
when
back
it was
together
so-
and I'll give you a book.
Yes.
And so she
When it was
said-
so
So it was larger.
Put it in.
because-
relative to the jaw size.
And so this is kind of what we were talking about yesterday, where you have these maladaptive behaviors that have set into motion because of earlier issues that may not be there now. But the behaviors
That's
still
right,
are.
that's where the cat goes. Turn it around.
But I think, like we can get the contraction in the mid-back, like for so it's contracting in there. I'm giving a lot of compression in there. You feel that, don't you? It's right there for shh. This here. Shh. Give me. Now see what happens. Okay, this. Okay, I want it to stay in there. Stay back. Stay back. Shh. No, let me do it. Shh. Stop. Shh. Don't do anything. Shh. That's like you say to a baby. Hush. 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 Yeah, that's right. So sometimes just giving, sometimes what will happen too is impromptu. I mean, there's multiple levels, as you can see, but you actually don't want them to do it. You just want to put the pattern in without that, because sometimes if it's such a strong pattern and it's been repeated so much, they will work right over you. I mean, you can't make the system do anything. So there has to be an interaction between what the clinician is doing and what the child or the patient is doing. You know what I'm saying? So if you've got a habituated pattern going, often to go in there and just try and prompt to change it, you have to come at it from a whole different, you have to almost trick the system. So like in doing something like hush, where I would be trying to get that hush. So I'm going for air, and then I'm going for position, instead of going for shh, which now is going to automatically set up that tongue position. Do you
No,
understand?
I do.
Yeah.
And that
It's
also
co-
fits in with these stages, because you've dropped down a stage.
I've dropped all the way down to phonatory,
Right.
to getting in that basic component to that production.
So you've reduced the complexity, the articulatory complexity.
Down
to get
at that. And also for her to focus more on the producing the unvoiced production than to worry about the other, which is right now really, it's a little above where she is. And so what's happening is she's trying to use another movement also to produce it. So to get better tud-does and ns would be a goal. And even though she produces them, it's not flexible right
It's
now.
also very broad.
It's very broad, and often it's through the jaw.
And it's not through independent tongue movement
No.
by this.
No. So you want to get this reduced. You want to get better rounding. She's got okay retraction. I'm not worried about that. But she fixes. And then she has to use jaw a
Her
lot.
sister does too.
Uh-huh.
And her sister doesn't have Williams, but her sister does the same thing.
But
That's one of the things the
her
students-
flexibility might be better though. So it's she's more, or she can.
the
She needs it too.
students really
She,
noticed when they watched Sasha that it was this almost a mask kind of thing, tension thing. And it's interesting because maybe she's doing similar things.
maybe.
So.
But if the rest of her system is more flexible, it won't affect the intelligibility so much. In other words, you can actually on TV and stuff occasionally you'll see a commentator sliding all over, but they've got such good control in other areas that slight slide doesn't really, it's not, and it may be a new production or something, but it doesn't hurt anything. It's when you have multiple things across the systems that are out of whack that it really starts to matter. Or if there's patterns that have, Thieland, if you read that book, will talk about what they call attractor states. An attractor state is just a simple way of saying that there's a certain muscle bias pattern that's going on because the system, it's easier for them to manipulate and use that subsystem. So jaw is used first with young kids anyway. Jaw is always used as the prime articulator in an infant. Everything comes out of the jaw. Once they learn to stabilize and reduce the jaw, then they can start to engage the upper lip and bring it down into the action. But first bilabials are closed through the jaw.
Absolutely, absolutely. That's
So-
that whole Davison-McNeilage issue that the speech is driven by this oscillating jaw pattern.
La 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 la.
Which
Well, I mean, we
talked
have it.
about in class.
Yeah, and we have it throughout our whole body. Actually, from our heartbeat up. It's a very interesting concept
Well, they're even
that way.
talking about neural activity now within oscillating
Patterns.
being driven by some kind of thalamic trigger.
Exactly. But I mean, what happens is then if that becomes the preferred pattern or preferred state, it does a lot of things. It drags the tongue with it all of the time. So the tongue can't gain independence. You've got to get the jaw reduced. You've got to get a much more reduced range
Okay.
so these other muscle groups can start to get involved. So, I mean, I'm saying with her, that would be one of the things we want to do is just pay attention to getting reduced range, getting things more rounded so she can get this tongue flexible and the interior to get it more independent because her S, it's not about up or down, but it's about staying in the mouth with airstream and using that tongue more flexibly, okay? Because right now it's being driven this way.
So in your chart, your chart of hierarchies then, how might you chart this?
If I did 1, 2, 3 for her, I'd actually, I think I would put labial facial first with her. I mean, this, and I put jaw second, and then I put anterior or lingual third. And why I'm saying that is because I want to release her into a more rounded position to get her rounding here because that's going to help the flexibility of that tongue. But I have to, in my mind, remember always that I have to keep the range reduced and stable. So that's what I'm saying. And my priority list in my mind, what it does is it focuses me on what I need to what I need to remember, what I need to focus on. Because otherwise you can get real lost in here. There's too many things going on all the time. So it just keeps you reminding why you're doing this, what you're doing it for. And then really when you start to look at phonemes that would come out of that, like I said, the oo, the o, we could certainly use all her bilabials because we want to develop much more independence. Then that secondary priority jaw means that I keep the range up, so I'm unstable. You see how I'm, okay. So I would want to bring in the pub, for sure. I'd want to have the rounded vowels, probably oo, o, ah, as my lower one. I'm not saying I would exclude other vowels, but I'm saying those are, again, going to be more focused on at this moment. So, and then I would want to in there because I want to get better independent control of that tongue so it can release within a smaller space and not with the aid of the jaw. So then I've got this core of phonemes that are all based kind of or driven from a motor perspective of development. So now I'm going to take these phonemes, and I could put a word like put.
Organ.
It is another word that I could use. In is another word I could use. Word like boat, boot. I mean, you can do a lot of things with that core group of sounds. You can start to make quite a few words. So you can actually then also, not only do you have the phonemes to the words, but you have the words to the phrases.
Right. Right.
So now you're developing your syntax.
Because she was
And
much
your
more
form.
comfortable with the phrases than is usually the case
Mhm.
in this situation.
Mhm.
We're seeing a phrase like that occur in her, but it was much.
Well, she's got first of all, she's got support. Second of all, she's got guiding. And I will use that in I guess the term itemite, but I mean, she's got a pattern that's already been laid down for her. And then also she knows if she can't quite get there, she's going to get support for that. So she doesn't have to do it on her own. I mean, and then eventually, once she gets it, she will be doing more of it on. I might just come in to prompt that t, that final t. Maybe come in just to get that initial ba. No, I mean, so normally I would say to most people, you want to prompt the whole phrase, because that's surface prompting for the whole phrase. You want to prompt the whole thing, because otherwise they only get parts of it. They don't get the whole. It's like giving you part of a movement. You know, you want the whole thing. But as your system can take over more, then the support gets pulled out until finally you're not getting. So again, creating those stock phrases within basic routines, and then I do the same thing and she does the same thing. So it's not that she's being asked to do something different than I am. I would use the same phrase. We would probably have several activities, and they could be everything from, like I said, depending on where we wanted to focus her. But we would use them in multiple ways across multiple environments with that core that we put. And then the teachers would also get a list of those words, and they would know that those would be words that if you could get them in anywhere, to go ahead, because it gives her more practice. And with some kids, those words become words that are very useful throughout the school day. And as she gains a little control, you expand that repertoire and you change that. And it just gets more complex all the way up the line.
Marielle, did you have fun?
Yeah. Yeah.
Can you say thank you?
Thank you.
Where's Debbie?
Debbie.
Where is Debbie?
Debbie.
That's right. That's right. This is Debbie.
Yeah.
So can you look at me and say thank you?
Thank you.
You're welcome. You are so welcome.
Go now.
Yes, you can go now. I wish I could see you more. It would be fun.